Hello, everyone, and welcome to today's GAAPP Academy. It's the second in a series on success stories from our member organizations, and we are so lucky to have one of our speakers here with us today, Dr. Nicole Hass from APEPOC, which is the Association for People with COPD in Spain. He will be speaking to us about a wonderful success story in advocacy and awareness that has taken place over the last several years in Spain. You can see here on the slide, actually, she's outlined the goal for us. We want to share a success story from our member organizations that will highlight how the organization has used their resources to improve patient outcomes or advocacy, in this case, both. What we want this to do is to serve as an example of what is possible for an organization. Now, this does not have to be something that your organization needs to do exactly. As a smaller organization, newer organization, there are elements of what Nicole will present that you may be able to replicate. But if you are interested in doing something that is ambitious and you have the resources or you want to work toward this as an ultimate goal, Nicole will tell you how they did this, what worked best for them, some of the lessons learned as they went through, and hopefully provide some inspiration because she is a very inspirational speaker and does wonderful things for the patients of Spain. So without further ado, Dr. Nicole Haas, thank you so much for joining us today and for all you do for people with COPD.
Thank you, Kristen, so much. So happy to have the possibility to share this little story, this little success story from our COPD community here in Spain with all of you. Thank you to Kristen and to GAAPP to give me the opportunity to tell you about a bit about more about our story, and hopefully it could be effective for you as well, and hopefully you can have some tips what you can do and how powerful our patient community really is, and how powerful it is to work in a network, So this was the goal, to present a bit the success story from a patient community. In that case, as Kristen already said, I'm the spokesperson and the technical advisor of the Spanish COPD Association, APEPOC. We started in 2020, and from the first beginning, of course, we were members of the GAAPP community, because we think, as I already said, it's so important to work together, to achieve the best. So let us talk about our story, what we carried out in APEPOC, in our Spanish COPD community, is a project related with COPD ambassadors. We wanted to engage political decision makers, because as we try to achieve a lot here in Spain, but we were not able to change a lot. So what we said is, oh my God, there are so many stakeholders, but sometimes we forgot a stakeholder who is very important, which are the political decision makers. So this project is about it. Let me give you a little overview of what's going on here in Spain. I suppose it's quite similar in other countries as well. The reality of COPD is horrible, really, to be honest, horrible. We have very little awareness. Only 20.9% of our population has knowledge of COPD, and very few people only know something about the importance of COPD, that it's very much related with other comorbidities, with affective disorders and everything. So horrible, really a very difficult situation, with a prevalence of 11.8, according to recent epidemiological studies here carried out in Spain in 2019. and all very catastrophic. I can't know how to describe it, where scandalous underdiagnosis of 74.6 of underdiagnosis. And if we talking about underdiagnosis, we have to talk also about dysdiagnosis at the same time, because a lot of disunfortunately of our healthcare professional are confused with the concept of COPD and asthma. Horrible. And this poor knowledge, of course, of this disease makes diagnosis and treatment absolutely difficult for our patients. So what we noticed is that our stakeholders are not only the patient community, not only caregivers or healthcare professionals or pharmacy, but also the political decision makers. This is what we are trying to carry out in this project. So we send a letter to a lot of political decision making all over Spain. You have to consider that here, I have to tell you that here the healthcare system is maybe similar to some of your countries or different to other countries. We have a general healthcare ministry, but at the same care, the healthcare performance is transferred to the different regions. So this is important, because if you want to achieve something, you have to contact not only with the general health ministry, you have to contact also with the different responsible of the different healthcare regions. So we prepared a meeting script for these meetings. We asked them to have it, and in this meeting script, we wanted to explain them the COPD, what's going on with COPD, and the current situation at the national and the regional level. You have to consider that most of our political decision makers, not all of them, but most of them, are not even healthcare professionals. So you have to explain them what's going on with COPD, what really is COPD, what is the burden of COPD, what are the comorbidities and everything, So this is very important, otherwise they will not understand you. On the other hand, we wanted to transmit them the patient experience of our patients. So in all our meeting, we were together with one of our patient experts in order to transmit their specific patient experience of each region. Important to have this specific local situation at the same time as well. We wanted to transmit at the same time the current and unmet needs we have nowadays here in Spain, and the necessary actions, because the thing is not to transmit something about the disease, but we need action. We need action, otherwise we will not achieve any improvement. In particular, you have to consider, and this is what we consider, and I would like to transmit it to all of you, that COPD and as all other diseases, respiratory disease at the same time, is not a question of ideology, but we have to adapt our dialogue, our meeting, to what's going on, what is important for our interlocutors. So we have to talk about the region. We have to give them data about the region, about the underdiagnosis and prevalence of the region. And of course, we have to talk, although it sounds a bit strange, but we have to talk about the party priorities. It's not the same, the party on the left or party on the right. We spoke to all of them. So for us, it was important to achieve really something special, and to move a bit their emotions at the same time. This is why we try to find out always their party priorities at the same time as well. So what we did, we had these meetings. You see here a map, a Spanish map, with our meetings held with these political decision makers from the north to the south, even in the different islands, in the Balearic Islands and the Canarian Islands, with all these different party party flags, because as I said already before, it's important to have a touch with all of them, you know. It's not the thing that we are all only talking with the government. No, we have to try to find their engagement by all of them. We had a wonderful anonymous support by all of them. We had more than 130 meetings, passed more than 30 parliamentary initiatives, and achieved unprecedented support for the COPD communication community in Spain. I have to tell you that never ever nobody, none of our diseases have this enormous support. Of course, it was very time intensive. But you have the possibility to have the digital possibility at the same time. So most of our meetings were held remote. Others were face to face, but most of them were remote. So after these more than 130 meetings with these political decision maker, we really noticed that there are leaders, really leaders who are very much engaged and very much committed with our COPD community, with other, wherever, because they have a family member with COPD or with respiratory disease or whatever. But the thing is that we did notice really some leadership, and we saw that this leadership is important, not only for recognizing this outstanding support by them, but also for guaranteeing a follow-up of our initiative. Otherwise, we would have done something only punctual, but we need much more. So this is why we said, okay, let us create a specific award for these people called COPD ambassadors, and we will give them a specific award for their specific support and for their commitment. After considering who really, or which organization really deserve this award, we considered that 13 important authorities, especially member of parliament, spokesperson, minister, and other, and 11 of official institutions, mainly regional and national parliaments, really deserve this specific award. What other characteristic? I think this is important to underline as well. You know, all of them, even if they are a person or a specific institution, they have leadership, they are empathetic, they are committed with COPD and with respiratory diseases. They are proactive, very important as well. Otherwise, we will not achieve any improvement. And they have fluent and effective dialogue. They are able to talk with us, to have the same understanding, and they are decisive. The award we prepared for these people or for this institution, it was quite a lot of discussion about it. We wanted to reflect, on one hand, our logo, of course, the logo of APEPOC, but at the same time, we wanted to reflect also our commitment to sustainability. This is why we have chosen an eco-friendly wooden plaque with the engraving of the tree handmade by a woodcut artist, as you see here in the picture. It included the name of the institution or the name of the authority, and at the same time as well the date. The tree you see there in the plaque is a logo of our association, and symbolization air, oxygen, and the bronchial branches of our lungs. Here you have a list of the people I told you before, or the institution I told you before. 13 authorities and 11 different regional, mainly regional parliaments, of course, and the Senate as well. Please remember, this is why I put it here. The most frequent information channel is the media, mainly the television and the radio as well, and the newspapers. But at the same time, very important also the social networks. This is where I put here not only the names but also their account, their LinkedIn account, and their Twitter one, or former Twitter, the X account, because it's very important to have this specific connection with them, not only with throughout the television. Here you have one of our examples, Carolina Darias. She was the former Ministry of Health. Very important for us, together with the Director General of Pharmacy of the Spanish government, Cesar Hernandez, because both of them truly guaranteed the not only the visibility of the COPD, but at the same time the best treatments for our patients, for the patient with grade 3 and 4 of COPD who needed the therapy therapy, and we had a lot of problems here. A certain sort of inequity in different regions, so important to have their support at the same time. Of course, always, as I told you before, all these meetings together with our patient expert. You see there on the left of the former ministry, Maria. Maria is our coordinator and patient expert of Madrid, and she was part of the meeting, of course. Important to transmit over the patient experience. Another example, the Congress of Deputies, very emotional, motivational, interesting. They put it everywhere. You know, we appeared in all the newspapers, even in the television. So very, very important these events as well. Here you have the example of different regional parliaments, always with the support by our patient expert, who were able to transmit really the patient their proper patient experience to the whole parliament. Of course, it's not easy to find people, a patient expert in our association in order to transmit the importance of the disease. But as you better know than me, that a lot of our patients have a lot of hospitalization because of their exacerbation. So we need people very able to transmit on the same time. You know, communication is absolutely necessary. Here there on the left, you see the parliament in Navarra, on the right in Aragon, another region, on down there in Valencia, on the Canary Islands. Only some example of these important events and we had with these different institutions. And I would like to transmit you also some examples of our authorities. Here on the left, you have this man. He's from Catalonia, from Barcelona, the spokesperson of the Parliament of Barcelona. He is on the right side. You see our patient expert Julian from Barcelona. On the other hand, you have another example of another authority. He's responsible, the ministry of a specific of Castilla León, a region here in Spain, and down there the Ministry of Navarra as well. Always are combined by our patient expert. So I would like to share with you also some testimonials we received by all these winners of our awards. And it was interesting because they were very surprised. They didn't expect an award, you know. So I only put some of these testimonials here, but I would like to underline it a bit, because it expressed a bit the importance these awards had for them. So one said, I'm particularly impressed with the burden of COPD. They never heard, they heard about COPD, but they were not aware about the importance of COPD, that the burden is so important, that's related with so many affective disorders and other comorbidities, and that our patients need so much support. Another testimonial, very significant, was that they were very. It's coming from regional government. They said, we are really surprised. We never received an award by a patient organization. It's a huge motivation for us. Wonderful, isn't it? Absolutely necessary for them. It was absolutely motivational. The same for us. It was emotional and motivational at the same time. A lot of gratitude and excitement for this wonderful award, said another of our authorities. So really impressed, really impressed, and they put this plaque there in their office and said, "Oh, I would share it with everybody," and wonderful, really wonderful. Thank you so much. You help a lot of people, and we will try to help them too. Isn't it great to have this engagement? Really, this is really stakeholder engagement. Having the possibility not only to transmit the importance of the burden of our disease, but having them in our board, to be part of our COPD as our community. So let us finish with my takeaways. We think, and not only our organization, but all of our political decision makers who or which receive this specific award, think that we need to make COPD really a public health priority, and policymakers must address reality of life with COPD. And I would like to underline 3 points. Observational studies in large patient cohorts have shown that at least 50% of patients diagnosed with COPD at 65 years of age already had lung function changed at 25 years of age. Can you imagine? So our profile of patients have changed a lot. We have a lot of young people now in our association. So we have to do a lot, not only related with diagnosis, but also with prevention as well. An early COPD diagnosis can impact positively on disease progression. And last but not least, COPD is the 7th leading cause of poor health worldwide, measured by disability adjusted life years. Really so important, so important. Thank you very much for your attention, and hopefully this little story could be effective and helpful for your organization, and open for any question.
Nicole, what an absolutely fantastic program, just in scope, really considerable. And I'm just so pleased to see it all come to fruition and to hear about how well things went for you. I have just a couple I have more than a couple beautiful comments about things that you've done that I thought were done so well. One of the things that we're learning over time is that in addition to the stories that patients bring to the conversation, right, their personal stories, it's very important to have data, to have numbers to show our policymakers. Pardon me. And I think that's one of the things that I was so impressed by is that you are very clearly equipped with data to go into your conversations, and not just data about the world incidence or prevalence of COPD, but what's happening in their location so that it's meaningful to them. And I'm sure that was that something that you found to be very important, the data aspect of it?
Yeah, I think data absolutely necessary. Otherwise, they will not take you serious. You know, that's really what's going
Yeah.
on. So, in our last COPD meeting there in Vienna, you shared with us this wonderful COPD codex with all these data. I think so important to be prepared for every meeting. So don't say only something only, not only, but don't talk
Mhm.
only about a patient experience, but you have to bring data into the conversation. You know, you have to talk about the importance not of only prevalence and underdiagnosis, but talking about the cost of COPD at the same time. You know, it depends a bit on the party, but we have to put this data into our agenda at the same time. Otherwise, they will not take us. Sorry, they will not take us serious. So a very important question you made, Kristen. Important to be prepared for every meeting and very well prepared. So the COPD important codex you presented the other day there in Vienna, I think could help us a lot.
Yes, I think that you can see how well prepared, how well planned everything was for this project. And I think that's important too. In moving forward, you can get so excited by the potential of what could be that you start moving before things are planned. And it was
Yeah,
very clear that you had an agenda for each meeting. You knew who the political parties were within each region, etc. So that did you find that the planning was just as important as the implementation, or how did it
it is.
weigh?
I can tell you, Kristen, that even we had a specific CV of each of our person we had the meeting with, so we knew beforehand if this person is related with is a healthcare professional or not, if this man or woman has a specific instruction with COPD or not. So it's absolutely necessary to be prepared. Otherwise, they what I said before. Otherwise, they will not take you serious. So they were very impressed by all this information. They didn't expect it, really, to be honest. Most of them, they didn't expect it. They expected, oh, a poor patient organization, you know, they will tell us they want money and that's it. No, that's not really the point. We want their support. We need their support. And for them, that means votes. It means votes. So important for them at the same time as well. So, and if they really noted this importance and our powerful, our importance in the whole, in this whole environment, in this ecosystem, I think we will achieve a lot more. This is why we did it, and but absolutely prepared for each meeting. Of course, it is very time intensive. It is very time intensive, and sometimes they give you the meeting from one day to the other, and they say, "Okay, tomorrow I have a half an hour, or I have 40 minutes for you, so you have to change the whole agenda in order to be there in the meeting." That's sometimes a bit difficult, but on the other hand, you know, you have the possibility to speak to these people and to change something. So let us adapt to these possibilities. Easier to have this remote, of course, to have these remote meetings than in person. But sometimes it's important to have these face-to-face meetings as well, especially if we are talking about health ministries. You know.
Yep. I agree. And I think that that is the same. I think when we in the United States, I can speak to when we have meetings with policymakers or any decision makers, really, you learn to expect the unexpected. You don't know what that schedule will look like or what amount of time they will have, etc.
Yeah.
One last question, if you will indulge me. One of the things that it can happen when, especially if you're maybe a newer organization and are not as well organized when it comes to awareness or advocacy. Sometimes it's hard just to get started. So, what would you recommend are the first steps anyone can take if they're interested in this type of program in general? What are first steps that they can move forward with?
Um, the first step for a new organization, I think, is important to have specific patient expert, to identify specific people who are able to speak to other stakeholders. Otherwise, you will not achieve the visibility you really need. So it's not it's it's not related with specific academic people or whatever, but you have to identify patients in your organization who are able to speak to other stakeholders. So we have patient experts very much related with, for example, healthcare professionals. We have others who are more able to speak to institutional responsibles, others who are very more emotional, maybe more important for other stakeholders. For please identify these people. You don't have to be a big, very big organization with a lot of members, but you need some people who are really very much committed with the disease and with your goals and with your objective, and you have to prepare them in order to be part of your commitment. Otherwise, it's very difficult to carry out an improvement only by the organization, And this is sometimes only possible if you speak to your patients. This is what I am trying to do. I spend a lot of time speaking to my patients, and when I speak to my patients, even it costs a lot of time, but you can identify. I have engineers. I have even healthcare professionals who are patients at the same time. A lot of different people who are able to transmit things better than you. And in that case, they will go together with you, with the responsible of the patient organization, but they have a lot of interesting knowledge you never ever can have. So as I told you before, for example, we are very much involved with sustainability, and I'm working very much with different engineers who know things about sustainability much more than me. So it's important for me to learn from them as well. So please, the first tip would be try to identify these people, these specific leaders in your own organization in order to transmit your commitments, your objectives to others.
Just fantastic. And then you know too that you're insured to represent the patient voice throughout the entire experience. That there is nothing done then, if that's where you begin, there is nothing done without the group of impacted individuals being involved because they serve as the foundation for everything. So I wish we could speak about this for several hours, and I think that we could. There's so much rich information in this example. I want to wish you congratulations, Nicole, to you and to APEPOC, because this is just a considerable undertaking, and how proud you must be for the outcomes that it has brought for Spain and for the people who are impacted by COPD. And we're speaking specifically about COPD in this example, but this could very clearly be translated to any condition, this effort to any condition that someone may be working in at GAAPP.
Absolutely, absolutely. And and in APEPOC, we're very much committed with the whole respiratory community, not only with COPD, because all our respiratory diseases are so much linked to one to the others. We have a lot of patients who have lung cancer. Some of them have asthma at the same time, a lot of things together. So we have to work as a group, as a team, and so happy to be part of GAAPP. I think you're doing a great job, not now, but before as well, to engage the whole respiratory community, and we have to make the respiratory community great again. you know, it's and that's so important to talk much more about the lung. Not only, we don't have to talk only about the heart, but also about the lung and heart. Even lung and heart are absolutely linked. So important, these networks. So happy to be part of GAAPP, and have you as a responsible of advocating and training, helping others to do much more in it. And I would like to encourage other organization, even if there's a small organization, they can do a lot. They can do a lot. Please take these little tips. Try to identify your leaders in your organization and be proactive, absolutely proactive, and disruptive at the same time as well sometimes. So go to the political decision maker and say, we want to speak to you. If you don't want to speak to me, well, I will put it there in the social networks. You have to be absolutely different. You make them change a lot and be important, and we are important. We are important. So happy
I
to be
love,
here for
I just love that. We are important. That's exactly right. Every single one of these patient communities. Dr. Nicole Hass, thank you so much. I learn something every time I speak with you. I really appreciate you being here today and sharing this with us.
A big kiss to the whole respiratory community, and please stay together and help us to make the lung important, really. See you.
Thanks, Nicole. Hello and welcome back. I am so pleased to have one of my colleagues here today who I have known for quite some time through GAAPP. This is Gundula Koblmiller from Lungenunion, Austria. Welcome, Gundula.
Hello, Kristen.
So nice to see you and talk with you today. And we thank you for spending the time with us to tell us about a very interesting, innovative, impactful initiative that is taking place in Austria. And I'm so glad that you're here to share it with us. So, what we'll be doing over the course of the next 20 minutes or so is having a conversation about what the project looks like, what has worked well, what you've learned from it, etc. So again, please feel free to jump in with any comments or ask any questions that you have, Gundula, but I will learn very much from you, and I know everybody else will on this call as well.
Thank you, Kristen.
So let's get started with the basics. So can you just tell us a little bit about the COPD oxygen therapy project that you have been, that you initiated and are implementing, what that looks like, who it's targeted towards, and what it includes?
Yes, actually, the oxygen therapy project in Austria is ongoing since 10 years. It is a project for patients who need oxygen for the therapy, which is COPD, but there are also a lot of other conditions, airway conditions, that need liquid oxygen therapy. And since it's been ongoing 10 years, we wanted to just, refresh the whole program a little bit. And we started the project for the Oxygen Pass and for the Mobility Pass project. In general, the project is about 50 pharmacies in Austria, which have a refill station for people who have portable liquid oxygen bottles. And whenever they move around, when they are doing their grocery, maybe go for visiting somebody, or maybe just travel somewhere, we have that list of these 50 oxygen stations, and they know where they can refill their liquid oxygen bottle, the portable one. So, and I think it really is very important, because people with oxygen or people with COPD should stay mobile. They should move around. They shouldn't be they shouldn't have that hurdle to stay at home because they don't have enough oxygen if they want to go for a travel or maybe for shopping for longer than maybe 3 or 4 hours, because this is about the time how long you can use the portable oxygen bottle. And we know from people who use this service constantly that they are very happy about that, because they know I can do something for 3 hours or 4 hours, and then I know where I can refill my bottle, and I still have another maybe errand to run, and I can do it. And we know it. And yes, having this mobility pass project now is just to inform even more people about it, to make it maybe a little bit more fun to do it, because when they get 5 stamps for refilling their bottle 5 times in one of the pharmacies, they can send us their full passports, and they receive a little mobility pin, which they can also put on their sleeve. So maybe you can see it. Yeah, this is the little Freddy, which is the mobility Freddy.
I can see him perfectly.
Okay.
And that makes it fun for people too. It makes it engaging, right? And I think that's always nice to get all the stamps then and be able to send it in. Even that little pin really means something to people when they're able to wear it.
Yes.
So this has been, to have this program for a decade, to then have added the component of the passport to it. This has been quite a successful program if you're continuing it for this long. It sounds very in-depth to all the relationships that you have built, etc. Are there factors that you've identified or that you can share with us that have been key to the success of the initiative? What makes it work so well?
Yes, I think it is a collaboration with the 50 pharmacists and also with the Chamber of Pharmacy in Austria, which is the umbrella organization of pharmacists in Austria. They support this project, and I think this is key. And on the other hand, we work together with with the oxygen producers. We started the project with, I guess, 4 or 5 of these companies, and at the moment there is only one left. But this one, which is Vivisol, is very happy to support the project even for the next 10 years. And this is essential because they are the ones who do the changing of the oxygen container in the pharmacies and also informing their patients about the service. This is their part. So the pharmacies support us, by giving us the space in their pharmacy. The company is doing their job by refilling the containers, and we are doing our job by informing patients and hoping that every patient who needs it knows about the service.
So the establishing those partnerships has been essential to the success of the initiative, and nurturing those, I would guess, as time goes on in order to ensure the longevity of the program too. Let me ask you a quick question about initiating those partnerships. How does one do that? If you're a newer or a less experienced organization who might be interested in doing something similar with pharmacies, or it could be other, retail organizations or whomever it is, or other partners that are dissimilar. But what tips might you have for people who are starting out and are not sure how to build those kinds of partnerships? What did you do well?
I think it's important to really make a good plan first. You really have to start from the scratch. If you know what you want to do, you also have to convince other people that this is a good project. So I think it's important to really draft a good concept, check the budget, how much you might need for the project, which is important, and then look for partners. And it's always the same, actually. And then you have to start talking with the different stakeholders who might be interested in also realizing this project. So, and if you find their goals and match them with your goals, I guess that's the key to success. And And then you just have to convince them that, you know, that we need support to do it and that everybody benefits from it. You know, it's not just a commercial part, which is not evident in this project, but it's about the patient. You know, it's about people who really suffer a lot, and if you give them the opportunity or the possibility to go outside of their house and do their groceries for themselves, or maybe go visit somebody else, maybe in the next town, and they know that they have the chance to refill the bottle of oxygen, then I think this is the best that can happen. But you really have to be convincing, and the better you know your project and what you want, the better you can also convince others.
I love that. That's a beautiful way to say it. Well, two things. One, a beautiful way to represent what someone with a lung condition is able to do once they have access to oxygen. For my family, I remember very vividly being able to go to the movie theater to see a movie for an extended period of time. That was great freedom for us. And the other thing I think you said so beautifully is that it is a win then for all the partners. Of course, the ideal being for patients. There are good outcomes for everybody who's involved. And another question that comes to mind leading off of that one is, how do you establish those relationships? Are you sending emails to people? Are you talking to people to see who it is that they know who might work in the field? Excuse me. What is the best way, do you think, or what have you found that works in even getting in the door with these agencies and organizations?
Yes, it starts with emails. You know, if you don't know the sponsors, if you don't know the stakeholders, if you don't know the people personally, you will have to send emails and introduce the project. You know, that has to be real, I would say, bullet points. You know, don't talk too much, because people don't want to read too much, but just try to convince them by giving them the most important pieces. This is how I do it anyway. But and then just keep recalling your project. You know, if they don't answer, maybe try to find another contact, or maybe try to find somebody. You can also try the phone, but they might only give you another telephone number or maybe another email contact. So yeah, sometimes you really have to be very resilient to reach the right person. But once you maybe had one project which was successful, you know it can take longer. And if you want to have that project realized, you just take your time. Don't make it stressy on yourself. Just stick to it. Maybe talk to more people, because people know other people which know other people. And maybe this is the way to get some personal contact, get some personal touch into the whole thing. And yeah, just use any chance that you have, even when you are at a meeting or when you go to congresses like we do. You know, we do go to congresses where we can show that there is a patient organization and maybe there is somebody. And if you're looking for some contact, just ask people, maybe they know somebody. Because I once heard every other person you meet has 1,000 new contacts you don't have.
Oh, it's a beautiful way to think of it too. I think some of us can be hesitant to ask for things sometimes, or to bring things up. But the worst someone could say is, no, I'm sorry, I can't help you with that. Really the worst that could happen. And many more times I hear people talking about the successes, given that they've shared their interests or their asks with other people. So when you said you have to be resilient, I smiled, because I think we've all been in that situation, right? You know, you meet many more no's sometimes, or you get many emails that are not returned, or you send many emails that are not returned. I know that was a challenge for you. Do you want to share any more about that challenge, or any other challenges you had that you think could be helpful to other people doing similar work, and how you overcame them?
I think we just have to dare and make clear that we are working for patients and we are working for people who are affected. And if you think about stakeholders who might be interested in such a project, which is the pharmaceutical industry maybe, or maybe some other patient organizations, or maybe politicians, stakeholders from the payer side, it's always similar, I would say. You know, it's always, the first step is always to send some emails, and maybe you don't get answers from your emails, then maybe you just resend them again because they might not have seen it or whatever, too much stress, whatever. So if you are consistent on what you want, you know, they realize, okay, this seems to be really important for this person, or maybe you know, just remind them again and again, because it's not for you, it's not for me, you know, I'm trying to do it for people, and these people I contact know what I want, you know. So actually it's about daring to just ask again, and maybe, you know, start little and then grow. You know, you don't need 5 answers, 1 answer is enough, and they then go together, you know, then start to build up on this basis, and then maybe there is a third person or third stakeholder coming in. So just be happy and celebrate every milestone.
Yeah, that's a good way to put it too. And I like the thought about being daring. I think I agree with you too that it does get a little bit easier, and the doors seem to open up in a way that they may not have before. The more partners you bring to the table, the louder your voice seems to be collectively. So it's interesting to hear that you've had that experience too.
Yes, because if you have one partner, the next one already sees, aha, there might be something which is which has a bit more maybe outreach.
It's suddenly there's more appeal to it too,
Yes.
right? From people looking from the outside. Oh, maybe I want to be a part of this because look who is at the table, which I think is nice, and all the better for patients, all the better. And again, in this case, we're talking about COPD, but these lessons I think apply no matter what condition a nonprofit is working in. I try to always stress that because the lessons learned and the techniques that we're talking about and the capacity building really transcends any of the disease states that we are all working in. So I know that this question is about sort of outcomes. My next question is about outcomes, and I know you've had to sort of adjust how you measured your outcomes. So tell me where you started, what your ideal was for measuring outcomes, and where you are now, and what that process has looked like. I think that's fascinating.
Yes, actually, as this project is running a couple of years already, we always have meetings together, the pharmaceutical or the oxygen company, then we as patient organization, and the pharmacists chamber. And we try to also measure the outcome of the project, and we know it's successful because we receive letters from patients or telephone calls, and they're very happy to have that service. So what we try to figure out is where are the most frequented pharmacies which patients use, and where are pharmacies maybe where patients do not know, or maybe too little patients know about the service. And we tried to monitor how many patients refill their portable oxygen bottle in each pharmacy, and that was not possible. I cannot tell the pharmacists to do it. So I hope that this umbrella organization, the Austrian Chamber of Pharmacy, could do it with their partners, but they could not even do it because the pharmacists wouldn't do it, because there is no price for the bottle, you know, because it's a free of charge service. And if something is free of charge, the pharmacy doesn't have to do any, any cash change or whatever. So it's difficult for them to monitor. And that still is a little bit tricky because we want to increase the number of pharmacies. or maybe exchange pharmacies which are not used. And we cannot do that as long as we don't know how much patients are in the pharmacy. So yeah, that was the biggest problem. We did not think about that in the beginning, but as it's still going on, we needed to get that straight. And can I tell you how we solve or how we try to solve it this time?
Please. I love that.
Okay.
Please.
Actually, we are trying to catch two flies with one clap, because we wanted to celebrate 10 years of the service in pharmacies, and we try to inform more people or more patients about this service. And together, with the three partners together, we did press release, and we started a new project, which is the Mobility Pass project. And this pass, patients receive this pass from the companies or in the pharmacy. And it's a little passport. And whenever they refill their oxygen bottle in the pharmacy, they receive a stamp in this passport. And as soon as they have 5 stamps in their passport, we ask them to send them to our organization and also tell us a little bit about their experiences and what they liked and maybe what they disliked. But if they send this little passport to us, they also receive this little mobility pin from us. And we already received a couple of passports, and all of them actually are very happy about the service now. And what the side effect of this mobility pass is that we see where people go to have their bottles refilled, and it gives us a good picture about pharmacies which are used, and pharmacies which maybe are not used so much at the moment, and maybe we just have to increase our awareness in these areas, or maybe do a little bit more promotion or whatever we can do, we can also inform the physicians, the chest physicians in that area, that there is a refill station in their city, for example, which helps.
I love that. I love that. Not just the part of it that's so engaging for the user, for the patient, but also that you didn't shrug and say, okay, well, our effort didn't work or they can't pan out for measuring our outcomes. And so we're just going to move on. You got creative and found a way to make this work for everyone. And I think that is really telling and can be an inspiration to other people who find themselves in a similar situation. So I know I've asked you many questions already, but just in closing, let me ask you if you had one piece of advice for an organization looking to do something similar, again, no matter the condition, what piece of advice would you give them, someone starting out?
I think if you work for a patient organization, you have to have a lot of resilience already, because it just needs a lot of time to realize some things. Maybe it needs time to find partners. It needs time to help people, or maybe to give them good advice so they can find help somewhere else. But I just think know what you do, because don't get disappointed because it doesn't work as fast as you think it should work, because sometimes it just needs more time. And I would just say, just know what you do and keep up your work, because if you can realize maybe only 80% of what you want to do, you're also successful with 80%. It's good enough. And maybe the ideal picture is always a little bit too high. Just push it down a little bit and just try small and build on these small successes and grow once you start now.
Sorry to interrupt. That's really lovely. I think building on the small successes too. And if people have planned in the way that you laid it out, how the planning was so important at the beginning, they would have planned for some of those risks, I think, too, right? So they would know that, okay, we might encounter this, we might encounter, it could be that we don't have this particular partner on board, and they would have thought through then maybe what those alternatives were. And it sounds like you did that. You were able to then to sort of adjust things. But then once you do that, I know that can be defeating for some people. It sounds like your approach is to sort of keep that faith and keep going, keep at it, because you will get to some of these outcomes. Just keep at it and don't get discouraged. Um, I can't wait to speak to you in a year and see how many pins you've given out. You have that again, because that must be so exciting to think of all the lives that are impacted. The extra movies people can go to, errands run, and grandkids visited
Mm.
are going up in Austria thanks to your work. So, Gundula, I thank you so much for your time today. I know people will learn a lot from this conversation, and we'll be sure to include the links to any materials that you'd like us to at the end of this presentation. Thank you so much. It's always wonderful to talk with you.
Kristen, thank you very much, and
Hope
thanks
to
for
see
that
you
call.
soon.
See you soon.